Hi, my name is Stephen Poplack. I'm a professor of radiology and a breast imaging specialist at Stanford University. So the question is, what is the BIRADS system? And that is a great question. BIRADS actually stands for the Breast Imaging and Reporting Data System. It was a text and atlas developed in the early 90s, I believe in 1992, by a group of breast imaging experts. And it was really designed to create a common and consistent set of terms that we use to describe breast imaging abnormalities. So the first function is to create what we call a lexicon, or a set of terms to describe abnormalities. And those terms have meaning. So to an imaging specialist and to all of the disciplines that deal with breast disease, they understand when we discuss a particular type of abnormality and describe it in a certain way, what that really means in terms of our level of suspicion or the likelihood that this could be cancer. So let me give you an example. If you have a mass in the breast, we might describe it as an oval mass with circumscribed margins. That means a smooth or well-defined margin. When we discuss it in those terms, that's very unlikely to be breast cancer and very likely to be a benign problem, like a breast cyst or a benign tumor, such as a fibroadenoma. On the other hand, if we were to describe the mass as an irregular mass with indistinct margins, that infers a much higher likelihood of breast cancer, because that's typically the way breast cancer will look on a mammogram. And not only have we developed a lexicon of terms for mammography, but more recently also for breast ultrasound and for breast MRI. So that's kind of the first component of BIRADS. The second important component is that if you use the terms correctly, the descriptors correctly, it leads you to the correct assessment. So by assessment, that is a category that we give each exam as our summary or impression of the likelihood of breast cancer. There are actually 7 BIRADS categories, and I'll describe them to you. They're 0, 1, 2, 3, 4, 5, and 6. 6 is only used for patients who we know have breast cancer. So, for example, if you had breast cancer diagnosed and now you're having medical therapy prior to your surgery, and we're repeating a mammogram or an ultrasound, you would have a BIRADS 6 known biopsy-proven breast cancer. The BIRADS 0 category is really reserved for screening tests, for a screening mammogram or a screening ultrasound. And that is, the assessment is incomplete and requires additional imaging. So when we look at screening, it's a binary problem. Either there's an abnormality or not. So it's either negative or benign, or assessment incomplete, meaning that now you're going to be recalled for diagnostic imaging. So that's a 0. The final assessment categories are categories 1 through 5. The first 2 are essentially a 0% chance of breast cancer. That BIRADS category 1 is negative, which is medical speak for normal, and a BIRADS 2 is benign. Again, those have essentially a 0% chance of being breast cancer. A BIRADS 3 assessment is probably benign. That's reserved for particular types of abnormality that we have over the years learned are very, very unlikely to be breast cancer. Less than 2% chance of breast cancer. And those we can safely follow, repeat an imaging test in a shorter period of time to prove that they're not changing over time, that they're stable. So that's BIRADS 3, probably benign. And typically, when you're given a probably benign assessment, we're going to re-image that abnormal breast at 6 months, 12 months, and then 24 months. After 2 years, 24 months, if it's stable, then we can consider it benign. So that has a less than 2% chance of being cancer, the probably benign category. The next category is the suspicious category, or BIRADS category 4, and that's been broken down further into low suspicion, BIRADS 4A, moderate suspicion, BIRADS 4B, and high suspicion, BIRADS 4C. If you have a low suspicion, the chance of cancer is somewhere between 2 and 10%. If you have a BIRADS 4B, moderate suspicion, the chance of cancer is between 10% and 50%. And if you have a high suspicion abnormality, or a BIRADS 4C, you have a 50 to 95% chance of that being breast cancer. And lastly, the BIRADS 5 is the most serious or severe assessment category, and that's highly suggestive of malignancy. And we reserve that for imaging abnormalities that are very characteristic of breast cancer. So a greater than 95% chance of that being breast cancer. So that's the BIRADS category system. And when we provide a BIRADS category, they're attached to a management recommendation. So we know that, for example, for a BIRADS 1 or 2, normal or benign, you just do routine screening. For a BIRADS 4, suspicious, or a BIRADS 5, highly suggestive of malignancy, we're going to recommend biopsy. So correct description leads to the appropriate assessment, which then leads to the correct management. Finally, the last part of BIRADS is the data and outcome monitoring. So BIRADS has identified for us the important data that we need to track and the important outcomes that we need to track, so that on a yearly basis, we can perform an audit of our interpretations, and that provides feedback for us to improve our skills. It also allows a way for us to track patients. So that's the third and important component to BIRADS.